Joining us now, Dr. Scott Gottlieb, former FDA commissioner and CNBC contributor. He also serves on the boards of Pfizer and Illumina. We also heard from one of our guests earlier, Doctor, that in Italy, there may be glimmers of a second derivative of, I guess, the acceleration may be slowing. Can you add anything to the China or Italy news, and is it positive?
Well, the China news is certainly positive. I think it demonstrates that, with containment strategies, you can get through an epidemic, and we've seen that also in South Korea and Singapore. Although they've had some new cases and a resurgence, they've largely gotten control of their epidemic, and South Korea was able to do that too. In Italy, you're still seeing the number of deaths rise, but they may be approaching the peak in terms of new infections. Deaths and hospitalizations are going to rise past that peak because their time to hospitalization is about 9 to 12 days. Time to death could be as long as 3 weeks, maybe longer. So people who are getting infected now or got infected last week, they're still going to go through that process. And so hospitalizations and deaths are still going to rise even past the point in which their new infections peak.
We're testing more in the United States. You've talked about that we are definitely going to find more cases now that we're testing so many people. Do you, at the same time that these numbers are going to be going up, do you expect the anecdotal evidence from emergency rooms and hospitals and ICUs, do you expect that to spike sharply?
Well, it is spiking right now. It actually started spiking about 2 weweeks ago. If you were looking at the syndromic surveillance data in major cities, they were showing spikes. New York City has showed a spike of people presenting with influenza-like illness who were testing negative for flu, and it was a time when the flu tests had gone back to baseline. So that was an indication probably 2 weeks ago that you were already seeing a signal of increased presentation. Now, some of that was probably people who had, community pneumonia and now were presenting because they had heard about the coronavirus and were worried, but some of that was probably coronavirus now in retrospect. So we're going to continue to see that build. New York's just in the beginning phase of this, and there's other American cities that are similarly seeded that are going to go through epidemic spread right now. So we're just at the beginning of the epidemic curve here. The steps we're taking is hopefully going to limit that spread, but we're at the beginning of what we saw in China and South Korea and, unfortunately, Italy.
Dr. Gottlieb said that his administration will have an announcement related to the FDA today. You have any idea what that might be?
I don't know specifically, but I can tell you what I think they ought to be doing. Right now, there's a number of, first, we need a point-of-care diagnostic. We're going to need something that can do massive surveillance more easily at the point of care. And so I think we need to try to move those to the market. There's also a number of promising therapeutics, and there's no reason why we can't have a treatment for this virus. This virus is not very intricate. We've developed drugs that target the features of this virus in other settings, and so we should be able to come up with a therapeutic in a reasonable period of time. There's actually about a half a dozen or so drugs being tested in China, some of which are antiviral drugs like favipiravir that are already approved for other indications. I think what we need to do is establish a very large, what we call a treatment protocol or a master protocol. We've done this before at FDA, where you allow a number of drugs to be tested simultaneously on patients in need, in this case, patients who get into trouble in the hospitals with this disease. And you can compare the drugs and see what's working. But what you do is you basically randomize the drugs against each other, or you randomize patients based on when they started receiving the drug, rather than randomizing to placebo. So it's a study. You're going to get good data. You're going to be able to figure out what's working. It's a little bit harder to figure out what's working because of the way it's designed, but you're giving everyone a treatment. So if you have 3 or 4 or 5 treatments that all look promising, you don't know which is the best, you want to figure that out, but you also don't want to deny people who don't have an alternative, don't have an option, a treatment. And so you can set up that large protocol. That's something that's been talked about. I think it's something the FDA and the administration can go forward with. The other thing, and the third piece of this, 2 other pieces just quickly, Becky, we need a massive surveillance system. We need to be when people present with influenza-like illness come the fall and they test negative for flu, we need to be testing literally tens of thousands of those samples for coronavirus so we can detect this early, so we don't get another outbreak or an epidemic. And the final thing we need, and we can have it, is the antibody-based prophylaxis I've talked about, an antibody drug that you can give people who are at high risk of coronavirus, elderly people, people who are immunocompromised, people with pre-existing medical conditions. You can give it to them on a monthly basis and basically protect them from getting coronavirus. If we have those tools, this is something we can live with. And I think our technology is sufficient that we can get those tools.
Hey, Doctor, we at this point are in the middle of trying to deal with this, and no one knows whether we're going to be successful, and we hear that not everyone's taking it seriously. But then again, we have done a lot in the last week that maybe we thought was going to be impossible. There are 9,000 or so, there's probably more, deaths globally. Do you think that we could manage to mess this up so badly in the United States that we could eventually, and I'm not talking about in 10 years of this coronavirus, but near term, could we have 1 million deaths? Is that a reasonable prediction to make that could happen in this country right now? Would you make that prediction, or that it's possible if we don't handle it right?
No, I wouldn't make that prediction.
Is it irresponsible to make that prediction?
Well, there was an analysis out of Imperial College that looked at scenarios, and that was one of the scenarios. Okay. I think that we're going to, we've shown we have the political will to quell this epidemic, and I think we're going to do what it takes to make sure that those out or bound scenarios don't come to pass. We're going to pay a price for it, but we're going to do it. I think we could get into the hundreds of thousands of infections. We could be the country with the most infections, but not millions.
No, I'm talking deaths. Deaths in the United States, 1 million deaths in the United States.
Right, and you'd need tens of millions of infections.
Which is possible to happen, but you don't think it's likely if we do the mitigation.
If we let it burn through our population completely unchecked, it would be possible. We're clearly not going to do that. And so we're going to certainly have tens of thousands of cases. We might get into the low hundreds of thousands of cases, but I think that we're going to have the political will to do what's necessary to keep this epidemic from becoming larger than that.